So there's one thing that happens every single day. We hear something about Kim Kardashian.
Every day. 2 or 3 times a day.
This time, she's actually facing a serious health issue. It affects a lot of women. Check it out.
Kim Kardashian is facing frightening issues surrounding her long-awaited second pregnancy. Sources claim the mother-to-be may have to have her uterus removed after she gives birth. During her first pregnancy, Kim suffered from placenta accreta, a condition where the placenta is attached too deeply to the uterine wall. It's been reported that Kim's doctors suspect she'll have this problem again during her second pregnancy, and they may have to remove her uterus. So how serious is this condition? And are Kim and baby's health at risk?
So an opportunity to talk about something that a lot of people aren't very familiar with.
Yeah, so basically this is an abnormal implantation of the placenta. And let me show you what I mean. When we talk about the placenta, which is a fetal organ, normally it just sits on the inside of the uterine cavity, and after the baby is born, it detaches or we remove it without any difficulty. In accreta, it's kind of implanted a little bit deeper into the uterine wall than normal, and so it can be very difficult to detach and can cause catastrophic hemorrhage or bleeding. And then you can have a deepening problem called increta, and in the worst case, placenta percreta, where it goes actually through the entire wall of the uterus and can attach to adjacent structures like the bladder or bowel. So this is a major obstetrical issue.
If this actually happens and it's as bad as it could possibly be, then she would end up having a hysterectomy.
Right. I think that absolutely. And I think that the thing that it just needs to be modified a little is that it wouldn't exactly be her choice.
No.
So this is something that when we diagnose it, and it affects about 1 in 530 pregnancies, it's increasing. We're not sure why. Partially it's associated with increased C-sections. But we pick this up typically on ultrasound in the second trimester, and we follow it very closely. Then what we do in obstetrics is we plan a delivery, a C-section, early usually. We don't wait till a woman gets to her due date. We plan that, and we fill the boat, we call it, with multidisciplinary surgical teams. Because if the you-know-what hits the fan on the OR table, we don't have a choice. To save the mother's life, we have to do an emergency hysterectomy.
And this all depends on the severity of it, which sometimes you may or may not know
Correct.
before. But it also highlights, in this case, how important prenatal care is and how important ultrasound imaging can be. Because in the past, before, you'd have no idea, right?
That's absolutely correct. And the last thing that we want in obstetrics is a maternal mortality. So that's what...
You know, and one other thing this highlights is just how brave mothers are. Because, you know, Kim Kardashian had a really tough pregnancy that first time. You know, she had preeclampsia, you know, she was miserable. She's very open about it. And the idea that she said, you know, well, I love my kid and my husband so much that I'm going to do this again. You know, it just really speaks volumes to women. Let women give yourselves a hand.
So very true. And certainly this is a case where we wish Kim nothing but the best with this pregnancy, and we all cross our fingers that it goes well.